Can you keep exercising with hip bursitis? If you have hip bursitis, you may wonder if it's okay to keep exercising and it's okay to push through a little bit of pain, or whether you need to stop and rest. And the short answer is it is okay to keep exercising if you have hip bursitis. In fact, you should keep exercising if you have hip bursitis. Now, as to exactly which exercises you should do, that's what I'm going to explain in the rest of this video. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain which exercises are okay to do if you have hip bursitis, which exercises you should avoid, and what exercises can help you recover from hip bursitis so you can get back to walking or running or climbing stairs or doing the other things that you want to do if you do have hip bursitis. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So first of all, what exactly is hip bursitis? Well, itis means inflammation of, and a bursa is a fluid-filled sac. Now, a bursa isn't specific to your hip. You have bursas in your shoulder and in your knee and in a lot of different places in your body. But bursitis means inflammation of that fluid-filled sac. Now, in your hip, the bursa sits right over the widest part of your hip, and the hip joint actually isn't right out here like a lot of people think it is. Your hip joint is actually in the groin. So hip bursitis is more of a soft tissue type of injury, and it's not always the bursa that's inflamed. A true bursitis is the inflammation of that bursa, but if you got a diagnosis from your doctor of hip bursitis, it may be inflammation of that bursa, or it may be the gluteal tendons that run right over the hip bone, or it may be the IT band. There are a lot of structures that run over the outside of that hip. And if you have outer hip pain, it doesn't really matter whether it's bursitis or tendonitis or IT band syndrome. It's probably a combination of 2 or 3 of those, to be perfectly honest. But it really doesn't matter because the mechanism by which those structures get inflamed or irritated or injured is the same. And largely that mechanism is when your hip bone goes too far out to the side and bumps into those structures that run over the outside of the hip. Now, hip bursitis or other types of lateral hip pain are most common when you're doing exercises like running, or to a lesser extent when you're walking. So what exercises are okay to do if you have hip bursitis? And really the simple answer to that is exercises that don't bother you are okay to do. And you should avoid exercises that do bother you. Now, it is a good idea to keep moving when you have hip bursitis because that keeps your joints lubricated, it keeps your muscles strong, and if you lose strength in your muscles, that makes you more likely to pop your hip out and inflame or irritate those structures that go over the outside of your hip. So if you are a runner and you only have hip pain, say 5 miles into your run, but you're okay for the first 2 or 3 miles, well, then stop at a mile or 2. Stop right before you start to have that symptom that comes on. And if it's later in your run that you start to develop symptoms, it's not necessarily a problem of muscle stiffness or muscle weakness. It's a problem of endurance, that your muscles are strong enough to keep your body balanced over your hip as you're running for the first 2 to 3 miles, but then they tire out. So if you back off of that a little bit and go to the duration of a run or length of a run where you're able to run comfortably, your muscles will build up their endurance over time, and you can gradually increase your running volume until you get back to that 5 miles or 10 miles or 13.1 miles or 26.2 miles or however much you want to be able to run. But you want to back it off until you have no symptoms and then start gradually building back up. Now, they recommend only about 10% increase per week. If you're starting at like 0.1 or 0.5 miles, obviously you can increase a little bit faster than that, a quarter to a half a mile, but you don't want to increase drastically fast. Now, if you're up at 5 or 10 miles, then that 10% rule holds pretty true. But again, you just want to go to the point you can without feeling pain. You should not push through pain if you have hip bursitis because you're just inflaming the problem more and making it last longer. Now, let's say your problem is with walking. If you have hip bursitis with walking a mile, then start with half a mile and build up your endurance. But if it's the first time you take a step, say you stand up from a chair and that first step is painful and the longer you walk, it just keeps getting worse and worse and worse. Well, in that case, you either want to do non-weight bearing exercises such as using a seated elliptical or using an exercise bike. And it's probably a good idea to walk with some crutches or a cane, something to offload your hip. Now, a lot of people will think when they're walking with a cane that, well, it makes me look old. And that's not necessarily the case. You want to use it just long enough that you allow your hip muscles to recover. Let's say you're lifting a barbell, and let's say you're strong enough to lift 50 pounds over your head, but someone gives you a 100-pound weight. Well, you're not going to be successful if you keep trying to lift that 100-pound weight. But if you can back that off and take it down to just an amount of force that you're able to control, for example, by using a cane to support your body weight, then you'll be more successful, and over time you'll build back up the strength in your hip to where you don't have to use the cane anymore, or you don't have to use the crutches when you're walking. So it's just a temporary crutch to allow you to be able to walk pain-free until you get strong enough to walk pain-free on your own. Now, what about stretching exercises? If you have pain on the outside of your hip, should you do stretching exercises? And there may be some stretches that are helpful for you, but this one stretch you probably want to avoid is doing an IT band stretch like that, or anything where you're pushing your hip out to the side. A lot of people think that when you have something that's painful, it's a good idea to stretch it. But in this case, the overstretching of that muscle over the hip, or that IT band over the hip, which compresses on the bursa that lays over the hip, that's the cause of the problem. So stretching further into that cause of the problem is not a good thing to do if you have hip bursitis. Now, there may be some other areas that are stiff. For example, often if you're overstretched on the outer thigh, your groin muscles or inner thigh muscles are stiff. And so doing a sideways stretch like that, where you stretch the groin muscles, or doing a butterfly stretch where you sit on the floor and push your knees out to the side, anything where your legs are going out that way is an okay stretch to do. But you want to avoid stretches where you're going this way. Now, what about strengthening exercises? If you have hip bursitis, which strengthening exercises should you do? Well, like I mentioned before, if you can run 5 miles before your hip starts to hurt, it's probably not a strength issue, it's probably an endurance issue. And so in that case, it's just building back up your running volume. But let's say the first time you take a step, it starts to hurt, or after just a few steps, it starts to hurt, then chances are you probably have a strength problem, where you're having trouble balancing your body over your leg because your hip muscles, your outer hip muscles, and specifically the gluteus medius and the gluteus minimus muscles on the outside of your hip, they're the ones that are responsible for holding your pelvis level when you're on one leg. So if you look at yourself in the mirror and you can't keep your belt level and stand on one leg for at least 10 seconds, then that's probably the place to start. Now, if it's something like this, or as soon as you pick your other foot up off the floor, you see your pelvis kind of fall a little bit, that means you don't have good enough strength in the muscles in the outside of your hip. And so if you can't even hold your pelvis level, your chances of being able to walk and certainly being able to run are not very good. So you want to start with just being able to balance your pelvis over one leg as you're standing on it. Now, if you have trouble just picking it up the first time, you can start with a toe on the ground and just hold the toe there for a little bit. And then when you get a little bit stronger and you're able to keep this balanced, take a little bit of weight off the toe and a little bit more weight off the toe until the toe is completely off the floor and you're still able to keep balanced. Now, once you accomplish that, you need to develop the strength to, say, land if you're landing when you're running. or to climb stairs if you're not a runner. So the next step from just being able to balance on one leg is doing a little squat. You can do this on a step, like on the bottom step of your stairs, like a little step up or step down, but basically being able to still keep your pelvis balanced, not going like that as you're bending your knee, but keep your pelvis balanced, knee going straight forward and backwards, weight on your heel because that will train your hip muscles more than if your weight's on your toe. That becomes a lot more of a thigh exercise or quad exercise. So weight on the heel, pelvis level, you're kind of sitting back a little bit and you're working on your balance and your motor control at the same time as you're strengthening your hip. Now the next step after that is to jump. Now if you're not a runner, if you're just doing your everyday activities and you want to be able to walk and go up and down stairs better, chances are those two exercises may be enough for you. But if you want to be able to run, you need to be able to land on one leg. And so just practicing doing sequential single leg hops and being able to stick your landing without doing like a double hop. You want to be able to jump and stick your landing and then gradually take bigger hops so that you are able to land on one leg and still control your pelvis. Then once you can do that successfully, you're probably strong enough to start running. And then it just is a matter of building up your distance and your muscle endurance rather than the brute force strength. So those are some exercises to help strengthen your hip muscles. Now, what about other exercises like clamshells? Well, those are pretty low-level exercises. If you're having trouble just walking or bearing weight, then chances are you may want to start with that. But if you're someone who regularly exercises, clamshells may be a little bit too low of a level exercise for you. Other exercises that are good for strengthening your glutes are squats, but those are mostly good for your gluteus maximus. Because you're balanced on two legs, you don't have a lot of that side-to-side strength. So a better exercise would actually be doing a lunge, where you're keeping your weight on your heel and you still have to control that side-to-side movement, but you're able to go deeper than you might in, say, a single leg squat. So those are some more exercises that can help you to strengthen your hip. So what other treatments besides exercise are good if you have hip bursitis? Well, one of the really common treatments that people get is a corticosteroid injection or a cortisone injection in their hip. And for some people, those work really well. Sometimes that knocks out the pain really, really quickly. And if that's the case for you, that's wonderful. There are a few things that you should know though. One, cortisone or other types of steroids, they weaken tendons. So although it's okay to have one, you don't want to have them repeatedly. The other thing you should know about cortisone injections is that although they can kill the pain pretty quickly, they're really strong anti-inflammatories, they don't necessarily fix the problem that caused that inflammation to come on in the first place. So even if you need a cortisone injection to get over the pain quickly, you still want to get the muscles stronger so you don't re-inflame that bursa or that IT band or those gluteal tendons that run over the outside of the hip. Because if you have to keep having cortisone injections, that's bad news. Now, if you're not someone who wants to rely on medications or have steroid injections in your hip, there's another treatment that works really well for hip bursitis and other types of lateral hip pain, and that's called dry needling. And what dry needling is essentially taking an acupuncture type needle and putting it in the muscles around the hip. And what research has shown is that there's a strong needle effect to injections. That whether you have a medication in the needle or whether you're just poking the needle in the muscles, when you hit a knot or a trigger point, there's actually a mechanical effect from the needle hitting that trigger point and releasing that knot or releasing that trigger point that oftentimes can relieve the pain really, really quickly, even if there's nothing in the needle. The other nice thing about dry needling is that there's no medication and therefore the needle doesn't have to be as large. because you don't have to shoot something through the needle. And so it's a very fine, small needle, which usually isn't quite as painful as a large injection needle. Now, if you are in St. Louis and you do need some help for hip bursitis, feel free to reach out to us at More for Life. We can help you learn the right exercises for your hip bursitis, as well as do dry needling if that's something that you are interested in. And if you're watching this video from somewhere else, but you found it helpful, give it a like and subscribe to our channel so you can get notified of our future videos. And speaking of our other videos, there's another really common problem that people with hip bursitis have, and that's laying on their side at night. And so in a few seconds, you'll see another video pop up about how to relieve pain on the outside of your hip when you're sleeping at night.